Aloha Kauai. Here's our daily COVID-19 briefing from Team Kauai for Wednesday, April 22nd. The number of total confirmed cases still remains at 21. Of those 21 cases, 20 individuals have now recovered or returned to their home on the mainland. The remaining one active case is in isolation in the hospital. All but one case has been confirmed to be travel-related. Kauai's tally of cases and other information on COVID-19 can be found on the Kauai Emergency Management Agency or KEMA site at www.kauai.gov/COVID-19. To view the total number of positive cases across the state, please visit hawaiicovid19.com. The daily count on this site is updated at noon every day. We are doing well, Kauai. We've been fortunate so far during this COVID-19 pandemic because of the early actions that you have taken. And now the question is, what's next? First and foremost, we must always remember that this is unprecedented, ever-changing event. As much as we like to plan ahead for our future, we don't have a crystal ball. We have to make our decisions based on the best available information we have at the time. We will continue to study other countries and states, but we also acknowledge that Kauai is unique. Our community took a distinctive stance early on with our overnight curfews and non-resident beach park permits. Then when the governor issued his stay-at-home order, we issued local rules for Kauai that created tighter restrictions for many across the island, further pushing the need to limit travel outside of our homes. We understood that this virus moved when we moved, so we needed to stay put. And for the most part, we did. That resulted in a positive outcome for our cases here on Kauai. Our numbers have stayed low, and we have thankfully reported no fatalities thus far. But, as each of you knows, our efforts to combat COVID-19 here on our island, in our state, across the nation, and around the world has come at a price. Many of us are out of work and experiencing at least some level, if not severe levels of stress, and we are all looking forward to getting back to our normal lives. I can assure you that the discussion of returning to normal has led to many long, often passionate discussions for all of us here in the Emergency Operations Center. We want nothing more than to get back to what we used to be. At the same time, we must acknowledge that COVID-19 is not behind us, and if we're not careful, it can and will get the best of us. So it is a constant balance of protecting life and safety while also preserving our livelihood. As I've said all along, the decisions we make here in the EOC are in direct consultation with our health officials. At the top of that list for me has been our District Health Officer, Dr. Janet Berman. So I'd like to bring Dr. B up to explain our decision-making timeline in more detail.
Mahalo, Mayor. Yes, it's true. As a physician, I have a very specific point of view when it comes to making decisions in this situation. From a public health perspective, the most important date to me here on Kauai so far was April 5th. That was the date of our first case of community-acquired COVID-19. Community transmission means that we can't directly trace this case from someone who traveled from outside Kauai. It's important because community transmission means that the disease could spread rapidly among our residents if we're not careful. Since April 5th, our recommendations for hand washing, social distancing, wearing masks, and staying at home as much as possible have been even more important than ever. Thankfully, our island has done a great job in heeding that public health advice, and so far, we have not seen any evidence of any further community transmission. That's a good thing. So is it time to open up and let down our guard? Well, from a public health perspective, our tried and true protocol in a disease outbreak, like measles or mumps or hepatitis, is to wait for 2 incubation periods to pass without any more cases of disease before we shift our course. For COVID-19, each incubation period is 14 days, or 2 weeks. So the benchmark of 2 incubation periods is 4 weeks after April 5th, which takes us to May 3rd. May 3rd is our next important date. Again, as a public health physician, if we have no more cases of community-acquired COVID-19 by May 3rd, I feel confident that in our current environment, we can, cautiously, begin to loosen some of the tight restrictions that Kauai has implemented and become more directly aligned with the governor's overarching order on essential functions. It's critically important for me to say that we could quickly undo all of our hard work if we're not careful. This has happened in other areas that have reopened too soon. We cannot open the floodgates, as they say. Rather, we must loosen these restrictions in a way that prepares and protects our island for the long term. We've all gotten pretty good at washing hands, wearing masks, keeping our distance, cleaning surfaces, and avoiding crowded places and unnecessary outings. We must continue to do these things as part of our daily lives. The more activities we participate in outside of our homes, the more these precautionary measures will be important. And yes, soon we will likely have better and faster and more kinds of testing. We may have apps on our phones to help us trace possible places of exposure. And one day we will have effective medications and vaccines available to us. All of these things combined will help us make this disease less deadly. But we are months away from those innovations. In the meantime, we need to do what we can to protect each other. And we know how to do that. That means masks, social distancing, and other sanitizing measures that must become part of our new normal. As we continue to allow more businesses to reopen, we will be asking both employers and customers to follow these practices. With cooperation from our community, we can keep our community healthy and safe as we move forward into this next phase. Mahalo to each of you, as always, for being strong, resilient, and willing to do what needs to be done to protect our island home. Thank you.
Mahalo, Dr. Berriman, and mahalo, Kauai, for your continued diligence. Let's highlight some of Dr. B's very important points. Yes, we all want to start to loosen restrictions, but our ability to do that centers around our one case of community transmission, which was reported on April 5th. In our decision-making process, it's important that we follow the advice of our healthcare professionals and wait 2 incubation periods or 4 weeks from April 5th before we make any changes to our status quo. So from now until May 3rd, if there are no additional cases of community spread during that 4-week time period, we all agree that we can start to loosen our local restrictions and be more aligned with the governor's order on essential functions, as outlined in his 3rd supplementary proclamation. For us here on Kauai, that means if there's no additional cases of community spread identified by May 3rd, we can resume construction. This may mean that golf courses can reopen. This could mean that many of the businesses that have been closed can reopen. It could mean that other affected activities can safely resume. However, there are 2 important disclaimers to this plan. 1, anytime any of us are outside, we must maintain social distancing with anyone that we don't live with. We must wear masks and we must wash or sanitize our hands regularly. And 2, if at any point we see a resurgence of cases, we should expect these strict restrictions to resume immediately. It was important to us that we clearly explain our thought process as we continue to make decisions for our island throughout this event. In the coming days and weeks, we will specify exactly what loosening restrictions allows and doesn't allow as we continue to follow the governor's orders. I also want to make it clear that our COVID-19 experience is far from over. We will get more cases, and even when we loosen restrictions, it doesn't mean any of us will be going back to life as we knew it before March. We're going to be living a new normal for the foreseeable future. But if we continue to play our cards right, we can keep our residents safe while also getting as many people back to work as possible. Folks, the time to be diligent and self-disciplined would be now. We haven't worked this hard to let our guard down and have to start from square one. That means we're depending on each and every one of you to self-govern your own personal behavior. Remind your personal friends and your own personal family of the importance of being safe during this period until May 3rd. What we're hoping not to see is a big surge that we saw on the Big Island in Maui. So that means we got to be extra diligent as of today moving forward. We've done such a wonderful job, and so many people have made personal sacrifices in the sake of saving this island and her people and protecting everyone that we know. So folks, I cannot impress on you folks enough that the time to be extra cautious with our movement, with our behavior, and our own personal action would be now. We are so close to seeing light at the end of the tunnel and starting to resume work in a safe stage manner and to really open up a lot of the restrictions that we had to put in place to protect this island, that it would be shameful if we were to put our guard down and get loose with our behavior just to see something unfortunate happen. So please, Kokua, we can do this. We are almost there. And I want to thank everybody up until this point for being a part of this mission. So there's a few things that we can do moving forward. Stay home as much as possible. Refrain from social gatherings or public outings. If you must interact with people outside of your home, keep a distance of 6 feet of separation and wear a mask. Do not leave home if you're sick unless you're seeking medical attention, and then only after calling your doctor first. Wash your hands frequently and clean surfaces often. We're going to get through this, Kauai. Stay informed and connected during this time of social distancing. We'll continue to post updates on our official County of Kauai Facebook page or on our Kauai Emergency Management Agency page at www.kauai.gov/COVID-19. The Centers for Disease Control is also updating its website regularly. For more information, please visit coronavirus.gov. Not everyone has internet access or follows the news, so please help to keep your loved ones informed. Kauai, we can do this. Hang in there. Take care of one another. God bless and aloha.